5 health checkups you should avoid after 70 that may harm you more than help. If you are over 70, you are currently the primary target for a 2026 medical phenomenon known as overdiagnosis, where aggressive screening for slow-moving conditions can lead to a cascade of invasive surgeries and toxic treatments that destroy your quality of life far faster than any disease would. Most seniors believe that more testing always equals more safety, but new clinical data reveals that for the body over 70, certain standard checkups carry a risk profile that far outweighs their potential benefits. We are talking about the cascade effect, where one false positive leads to a biopsy, an infection, and a permanent loss of mobility. You need to identify these high-risk screenings immediately, because the difference between a peaceful, active decade and a spiral of medical complications is found in knowing when to tell your doctor no. You won't want to miss the final habit, or 99% will miss the last tip and will be stuck with medical overtreatment for life. The first checkup to reconsider is routine colonoscopies after age 75. While colorectal screening is vital in middle age, the lead time for a small polyp to become a dangerous tumor is often 10 to 15 years. In a 70-year-old body, the prep for a colonoscopy causes massive electrolyte shifts and dehydration that can trigger heart arrhythmias or kidney failure. Furthermore, the risk of bowel perforation increases significantly as the intestinal walls thin with age. Surgeons are now warning that for many seniors, the clean bill of health from a colonoscopy isn't worth the risk of a catastrophic procedural complication that could end your independence overnight. The second high-alert checkup is aggressive PSA testing for prostate cancer. Science now confirms that most men over 70 will have some cancerous cells in the prostate, but these are typically slumbering tumors that would never cause symptoms. When you screen aggressively, you often find these non-threatening cells, leading to overtreatment like radiation or surgery. These procedures frequently result in permanent incontinence and impotence without adding a single day to your life expectancy. For a senior over 70, the watchful waiting approach is often far superior to the search and destroy mission that leaves you with life-altering side effects. However, many seniors feel pressured into these tests because they struggle with metabolic sluggishness that makes them feel vulnerable or older than they are. This is a common 2026 health crisis where thermogenic resistance keeps you in a state of low energy and chronic inflammation. A lot of my viewers are getting great results with a new breakthrough called Citrus Burn. It's a 100% plant-based formula that helps break through that metabolic wall. One thing that's helping thousands right now is how it uses Seville orange peel to boost that internal fire. If you want faster results without feeling deprived, this is what I recommend because it activates fat burning even while you sleep, and it comes with a 180-day money-back guarantee. Third is annual EKG stress tests if you have no symptoms. For a senior over 70, these tests have a notoriously high false positive rate. A minor, harmless abnormality can lead to an unnecessary cardiac catheterization, an invasive procedure where a tube is threaded into your heart. Every invasive heart procedure carries a risk of stroke or blood clots. If you can walk up a flight of stairs without chest pain or shortness of breath, an annual preventative stress test might be searching for trouble that isn't there, leading you down a path of surgical momentum that is hard to stop once it begins. Fourth is routine bone density scans, DEXA, every single year. While knowing your bone health is important, overscreening often leads to the immediate prescription of bisphosphonates. These drugs can actually make the bone brittle over long periods and have been linked to rare jawbone necrosis and atypical fractures. For a senior over 70, focusing on functional balance and impact nutrition is often more effective than chasing a T-score on a machine. If your score hasn't changed in years, the harm of intervention from the drugs often outweighs the benefit of the data. If you're finding it hard to stay active and bone strong because your weight is putting extra pressure on your joints, one thing that's helping thousands right now is Citrus Burn. It is specifically designed to reduce those intense cravings by up to 54%, making it much easier to stay light on your feet. Plus, they're offering 2 free bonuses right now, the Rapid Detox Protocol and Mind Over Metabolism Mastery. These are perfect for cleaning your system so your body can naturally maintain its structural integrity. It's 100% plant-based, and contains no stimulants, which is vital for senior heart health when you're trying to avoid the overmedication trap. Fifth is tight glycemic control testing, A1C. While managing blood sugar is key, trying to force a 75-year-old's A1C down to a youthful 6.0 can be deadly. Aggressive treatment leads to hypoglycemic events, sudden drops in blood sugar that cause dizziness, confusion, and catastrophic falls. 2026 geriatric guidelines suggest that a looser target of 7.0 or even 7.5 is often safer for seniors. It prevents the fainting spikes that lead to broken hips, which are far more dangerous to a senior than a slightly elevated blood sugar level. If you are struggling with a weight plateau that makes your doctor want to increase your medications, one thing that's helping thousands right now is the biggest discount on the 6-bottle pack of Citrus Burn, which currently includes free shipping. This 2026 formula helps break through thermogenic resistance by activating your body's natural heat production. When you carry less visceral fat, your insulin sensitivity improves naturally, allowing your blood sugar to stabilize without the aggressive drug targets that cause dangerous dizzy spells. It's the perfect natural solution for those who want a 6-month stability reset with a 180-day 100% money-back guarantee. The final habit that 99% of people miss is the quality of life audit. Before agreeing to any screening or new medication after 70, you must ask your doctor, will the results of this test change my daily activity level or my comfort today? If you miss this last tip, you are handing over your golden years to a medical algorithm rather than your own intuition. The audit forces a conversation about lag time to benefit. If a test screens for a disease that takes 10 years to manifest, but the side effects of the test or treatment will hurt you tomorrow, the test is a net loss for your health. This simple 10-second question filters out the unnecessary medical noise and ensures that every intervention you choose is actually designed to keep you vibrant, active, and independent, not just a better patient on paper. Your health is about how you feel, not just your lab values. You don't have to be a victim of over-medicalization. By clearing the metabolic sludge, questioning high-risk screenings, and using the quality of life audit, you are taking a stand for your autonomy. You have the power to stay vibrant and sharp well into your 90s by focusing on functional health over paper health. Start your audit at your next appointment and feel the confidence return to your healthcare decisions. Subscribe. Which advice will you start applying today?